and I was a public health dentist, working on the elderly, working in the hospital, but primarily with children. And so that was the beginning of my career where I started to think about what I had been taught in dental school. And I felt I came from a really great education. And over the years, I saw many kids, and I always like working on kids. But it's kind of interesting. I started to see the same things happening over and over again. And the story that I want to tell really starts technically with me because I was one of these kids that I started to see. And kids these days are suffering from the syndrome. And just to, if you're a parent listening to this, these are some of the things that you may have noticed that many doctors won't put together, though they all fit. So there's a bunch of different things that go wrong with kids. The first thing is failing sleep. Right from birth, many kids are not sleeping properly, and that's a primary vitamin D deficiency. Now, even still here in Los Angeles, where I live, many pediatricians and doctors are not recommending vitamin D supplementation for younger patients, which is tragic because in the old days, we lived outside when we were hunter-gatherers. And even earlier or not that long ago, mothers all had higher vitamin D levels because of how we lived. No sunscreen, spending time outdoors, less air conditioning, no fear of the sun, really. And so when kids don't get enough vitamin D, they don't sleep properly. They become colicky, irritable, and often skin rashes that looks like eczema or psoriasis. These are the first telltale signs of low vitamin D in infancy. It's very common, much more common than people think because doctors don't learn about this in medical school. It's not on the radar. They are not testing your child when they're born for vitamin D, though they should. And so as the child gets older, these are the symptoms to look for. Number one, very profoundly, something called bruxism, which is clenching and grinding of teeth. Many parents are hearing this noise coming from their children's bedroom, and they're asking their pediatricians and their doctors, what is this noise? Why is my child making this? And doctors don't know. They don't know for many reasons, and it's tragic. They say, well, your child will grow out of it. That's not the case. So bruxism can happen to adults or children. And many people think that bruxism, clenching and grinding, is caused by stress. But what stress is a 4-year-old under? So bruxism is a neurological condition. It's a short circuit that is caused by the part of the brain that's supposed to control sleep and breathing. It's not working right. And instead of sending a clear signal to the body to be paralyzed during sleep, to breathe and to swallow, these are the important things when we're sleeping, there's a mixed signal and people end up choking in their sleep, snoring, and grinding their teeth. Now, bruxism can be daytime or nighttime. If you're an adult and you grind your teeth at night, you're normal. If you're an adult and you grind your teeth during the day, you're extremely low on vitamin D and you need to get that tested and taken care of right away. The actual clenching that you do during the day, that's a sign that your vitamin D level is so low that you don't have enough B vitamin. 2Ds or more D makes a B. And that's how it works in the human body, is that vitamin D and sunlight. Keep in mind that when I say vitamin D, I really mean sunlight. Vitamin D is a proxy for sunlight in our body, and we're supposed to get it from being outside. We can eat it. And because people have jobs and people have things to do, it's not realistic to get all your vitamin D from sunlight, but you should try and get some, and even with kids. So, and why do kids low on vitamin D? Parents are putting on sunscreen, kids are staying indoors playing on computers, and the foods that kids are eating is preventing their body from activating the vitamin D properly. And those are kind of complex things, but they're all real. And the basic understanding is that kids don't have the right vitamin D level. So we have bruxism, we have snoring. If your child snores, they're extremely low on vitamin D. The ones that are less obvious are thumb sucking, finger sucking, and wetting the bed. These are all classic symptoms of a child who's extremely vitamin D deficient. Now, where this starts to go, there are certain children, I was one of those children, right from the time I was born, I suffered from terrible rashes. My parents didn't know what to do with me. I was a very fussy eater, constantly crying baby. And as these symptoms progress, you'll start to see dental decay and even pediatric gum disease. We see this quite a bit in populations with darker skin who need more time outside. So these are the pediatric symptoms. Now, it gets a little easier to figure this out because then we get swollen tonsils. If your child is the one who's getting constantly sick from colds and flus and allergies, allergic to cats and dust and grass, has asthma, or has been diagnosed ADD, attention deficit disorder, this is your child. This is what I call pediatrician's blight. Now, the good news is that this is a syndrome that's so easy to reverse, and that's the primary reason why I got into this field and why you'll see cartoon characters behind me, is because my audience is really kids and the parents of kids. And I really want to share this syndrome that I call long face syndrome with everybody who has children or knows young children who are developing. This is the first place where your health starts to go wrong. And I would say that the syndrome that I'm going to describe follows the 80-20 rule. 80% of kids with these symptoms will be very, very quickly cured by simply raising their vitamin D level and making a few lifestyle modifications. 20% will need special and extra attention and care, and these are kids that have other genetic issues, but the syndrome I discuss is actually environmental. It was first identified by another Canadian dentist like me by the name of Weston A. Price. And Dr. Price traveled around the world. This was the first investigation of what we call blue zones, going to places where people live a long time and saying, hey, what are these people doing that's keeping them so healthy? Well, Weston A. Price in the 1920s and 30s traveled around and photographed different Aboriginal cultures to figure out why people's teeth were going bad. And in those days, prior to antibiotics, people's teeth were terrible. Everyone's getting dentures. And going to the dentist was not a good experience. It's still not great today, but in those days it was really bad. And so he said to himself, my patients have terrible teeth. I want to find populations that have great teeth and find out what they're doing. And ultimately, he discovered there were two substances that almost all really Aboriginal peoples would give to their younger people as a fertility measure when they were going to have kids. And it turns out that these two chemicals were vitamin D3 and vitamin K2. Now, they were from natural sources. They were found in butterfat, especially in the milk and meat of animals that eat green growing grass. The greener the grass, the higher the level of vitamin K2. And then the other component was cod liver oil, which is high in vitamin D. So both of these substances were critical for health and wellness and for fertility. And they gave these foods to people who were going to have kids, because right from conception and preconception, you want mom and dad to have evolutionary levels of vitamin D. If you want to pause and check what that means, anything over 40 nanograms per milliliter, okay? My ideal is higher, but that's the base minimum, and that's the amount that many, many people who live outside will have. I have gone up to a level of 100, so it's natural. Kids had terrible teeth. Brother had good teeth, followed the ancestral diet. Other brother eating cookies and cereal, and cereal was around in those days. And John Post put sugar in his cereal because he wanted to one-up Kellogg. Yes, your child should chew healthier real foods, but it's really the low vitamin D and low vitamin K2 that were instrumental in the destruction in one generation of these people's mouths. No room for all their 32 teeth. Terrible crowding, narrow arches, and terrible decay and gum disease. And this was an epidemic. This was very normal in those days. So keep in mind that we have to think about, these were such big cultural differences that many missionaries went to places and made people put on clothing. And that is really instrumental in cutting off Aboriginal people and us as humans from our environment. So everyone's just blaming these grains and all that. And yeah, those are a major part of the breakdown, don't get me wrong, but it's lack of sunlight. When we think about something like tuberculosis, many people don't remember this, but tuberculosis is a bacterial skin and lung infection. And prior to antibiotics, the cure to tuberculosis was lying in the sun at a place called a sanatorium. And so this was normal medical treatment, and it disappeared when Big Pharma came in, and that was, sort of the beginning of our demise here, is that we started to use a pill to fix something that was actually environmental, and it's still happening today. Now, we can do that because I want my patients and I want anyone to have high vitamin D, even if they have to take a supplement. Is it as good as natural vitamin D? Definitely not. Is it good in a pinch? Yes, it is. And I think that taking a vitamin D supplement is a really good entry point into understanding how much better and healthier you're going to be, and into thinking, well, I'm taking a pill. What if I got some natural vitamin D? And I strongly advise that, because when you make vitamin D in your body, it's a little different process. It's attached to sulfur, one of my cartoon characters behind me. It's called sulfated vitamin D. And what that does is it allows your body to transport it. So sulfur is one of my cartoon characters, is the ultimate driver. If sulfur gets attached to something, it gets sulfated, and there's enzymes that attach it. Once something's been sulfated, it's good to go into the blood. So sulfur is the transporter that brings chemicals and it deactivates them. So if you have, a neurotransmitter, once it's sulfated, that will shut off the actual hormonal active component and it'll be transported to wherever it's supposed to go. And when I say vitamin D, think sunlight, because prior to very recently, you couldn't get vitamin D other than cod liver oil or supplements. You have to get it outside. And we weren't afraid of the sun prior to the 1980s. And I remember that time. Because vitamin D is such a profound activator of the immune system, when kids are low in vitamin D, everything changes. The gut microbiome changes, the lung microbiome changes, and the oral or mouth microbiome changes. And it allows the species of bacteria to overgrow that we don't want. In the gut, it's candida or fungus, causes symptoms of SIBO, primarily a vitamin D deficiency. To anyone who has SIBO, if you don't know your vitamin D level and you don't keep it at 60, don't bother doing much else. That's root cause. Get more sunlight. So low vitamin D means poor immune system, and the immune system is there to fight viruses, fungus, bacteria. So what happens to these kids? They get colds after flus, after colds, after lung infections. They're always at the pediatrician. They're always on antibiotics, which is further destroying the gut microbiome. These are the kids who get terrible decay, even though the parents are brushing their teeth and taking care of them. And these are the kids who show up with eczema and psoriasis and asthma and all these autoimmune conditions. These are the low vitamin D kids. This is still not on the radar of almost any Western doctors, just so you understand. So as this issue happens, you stop breathing through your nose, but it gets more complicated because when you're low on vitamin D, you can't bring calcium into the body. Everyone knows, or they think that, you get vitamin D from milk. That's not necessarily true. It's put in there artificially. But vitamin D allows you to bring in calcium into your body so that you can store it in your teeth and bones. And that's what our teeth and bones are. They're a storage system for calcium. We build it up in the summer when all good hunter-gatherers are outside in the sun, hunting. And then we use it up in the winter when there's no sun and there's no vitamin K2. So the other component is the vitamin K2. Calcium comes in through vitamin D. And once the calcium gets into our bloodstream, we have to take that calcium, put into our bones, teeth, cartilage, and all of that. That needs to be managed by other enzymes. Now, vitamin K2 is a cofactor for the enzymes that manage calcium. If you don't have vitamin K2, the two specific enzymes is osteocalcin and MGP, matrix GLA protein. These two enzymes are unactivated and they cannot help your body to put calcium where it's supposed to be. So when you're a kid, what happens is calcium is improperly placed into the nasal septum, which can prevent you from breathing properly through your nose, which is a disaster. And then the other thing is that you simply don't have enough calcium to grow the lower jaw. And I was a victim of this. I don't even have second molars, never mind wisdom teeth, because I was so vitamin D deficient as a child that my lower jaw never grew. And I'll refrain from showing my profile, but it's the profile of long face syndrome where the upper jaw gets squished together by mouth breathing. When the mouth is open during breathing, it physically pushes the palate and makes it smaller. We catch these kids at age 6, 7, and 8, and we have to do palatal expansion. If your child went through palatal expansion, it's exclusively a vitamin D3, vitamin K2 deficiency. It's not genetic. There's always a genetic component to these things, but they're really purely environmental. People who have an adequate amount of D3 and K2 will have broad arches and room for all 32 teeth. So this is a major factor as these kids start to grow. They have micrognathia, small jaw, and now they're breathing through their mouth, and that ruins the entire circulatory way that we want air to come into our body. You're supposed to breathe in through your nose, which puts in nitric oxide, humidifies and filters the air. This is how we were designed. So if your child is mouth breathing, it's bad news. And you can find out if you ask your child to close and swallow, you'll see they're going to stick their tongue forward to close the gap that they have between their front teeth, because that's how they're breathing. Can't breathe through the nose. Step 2, improper breathing at night. Step 3 is as that child grows, you don't have enough calcium to put in the right amount of jaw and teeth material, the calcium, but it gets even worse because the floor of the mouth, okay, the bottom of the nose is the floor of the mouth. And if we have it all narrow, we have a very narrow airway. This is how our airways start to be formed. And if we restrict that jaw growth, we end up with these tiny little airways, so that when we start to talk about pediatric sleep apnea, And yes, if your child has those symptoms, they have it. It's completely reversible. It's not caused by obesity. It's caused by low vitamin D and low vitamin K2. That's the root cause. Your child may be obese, but it's because their vitamin D level has been low for a very long time. They keep on putting on weight because their body is stuck in what I call permanent winter. Vitamin D is a proxy for sunlight. When the vitamin D level is low, it's winter. When the vitamin D level is high, it's summer. And all animals on this planet go in these cycles of summer and winter. That's who we are. So this syndrome is basically happening in front of everyone's eyes, but those are the main symptoms. And then these are the kids who will need to have braces twice. They will definitely need to have their wisdom be taken out. We used to extract premolars, and now we don't do that anymore. We try and expand the jaw. And that's the basics. That's a syndrome that I suffered from. I was one of those kids. And these things were just not recognized because it wasn't as common in those days as it is now. And keep in mind, I grew up in Canada, in central Canada, and most likely my mother was already vitamin D deficient when I was born. My brother was and is very healthy. I was not. So it makes perfect sense. And that's why we'll see a lot of these autoimmune conditions, they happen on the later kids because the mother becomes more and more and more vitamin D deficient because the pediatrician, the OBGYN doctors, there's no one monitoring this. And there's no one saying, hey, you just had a baby. You could be low on vitamin D. Let's get your level back up. Third trimester symptoms of weight gain, snoring, heartburn, back pain, these are all vitamin D deficiencies. And that's what it is. Women who have high levels of vitamin D or normal levels, they go through completely different pregnancies and postpartum depression, 100% vitamin D deficiency. Inability to lose the baby weight, 100% vitamin D deficiency, not on doctors' radars. Kids really are growing during this stage. And so if they have adequate vitamin D3, vitamin K2, almost at any age, this can be corrected. Once a 7-year-old already has a collapsed palate, vitamin D won't fix it. Vitamin K2 has two forms, MK7 and MK4. The popular form is MK7, but if you follow up on Weston A. Price's website, you're going to find that the MK4 version is the kind that can cross the placental barrier. So that's the one that I would prefer for pregnant women to supplement. If you're old, if you're not having children, it's irrelevant. You can get these from eating lots of high quality meat and organic grass-fed dairy. But if you're going to supplement, especially if you're going to be pregnant, I would supplement an MK4 supplement. It can have some MK7 as well. If your child has recurrent swollen tonsils or recurrent ear infections, they're vitamin D deficient. And ear infections, the doctors don't understand that they're literally getting bacteria coming up that's going into the eustachian tubes. And this is a vitamin D deficiency at its heart. I can tell you about a patient that I had who came in. It was one of my assistant's daughters, and she was 12. She had been having tonsil infections for many years. And by the time she turned 13, her doctor suggested she have surgery to remove the tonsils. We put her on a vitamin D regimen. They shrunk down and they never bothered her again. She's 16 or 18 years old now. It doesn't work for every child, but before I would ever put my child through a tonsil surgery, some of them are necessary. I would want to know that they had a normal evolutionary vitamin D level for at least 6 months before I would ever do that. I would never want to remove any tonsillar tissue if it wasn't necessary. Sometimes you have to, but your child, if your child had chronically swollen tonsils, this is really root cause. Below 20. Below 20. And keep in mind that if you're in the major medical paradigm, if you're 21 or 22, your doctor sees that falling within the normal range. It used to be 30 to 100, and then they changed it. Everywhere else changed it from 20 to 50, and they changed that due to AI, because they said, oh, everyone's down, let's just make the normal down. There's not a single study to support that's healthy. So if you go to your doctor and your doctor says, oh, your vitamin D level is toxic, they'll think because it's over 50 it's toxic, but the real limit is 100. That's the first thing. The second thing is no one's ever died from a vitamin D overdose, so everyone should take a deep breath. So if you're above 30, you're probably not going to be sick at 30. You'll have some bruxism. 30 to 35, you could have some symptoms. Some people won't. When you're at 20 and below, you're going to have many more symptoms. But 20 to 30, that's the range where people have all these anxiety, depression, IBS, and they'll be like, well, my vitamin D level is fine. My doctor measured it, and he's amazing or she's amazing. The way I view vitamin D is that you have a reservoir, and that's your tank. And even though a great daily dose, the way you can think of it is it's 1,000 international units, IU, per 25 pounds. So 4,000 IU for a 100-pound person. if you're low, giving that 2,000, 2,000 or 3,000, 4,000, it's not going to fill the tank. You want to have a higher dose called a loading dose. I don't believe it's extremely natural, but I would much rather someone do something unnatural than end up in the hospital with an infection, right?
Okay.
So the maximum daily dose I recommend for anyone who's over the age of 18 is 20,000 international units. And the reason is that's the amount that you can make sun tanning in your bathing suit on a nice day. So that's physiologic. Once you get to that 20,000, sunlight is actually turning the vitamin D into something called lumestrol, which is where vitamin D gets switched into a sunscreen. All right. And yes, people are working on lumestrol as a sunscreen, but they need funding, and that comes from big pharma. So you won't see that anytime soon. So I like to think of 20,000 as the maximum dose, and that's a short-term dose. Now you can take more. You can. I'm on video taking 100,000 IU, and it's still perfectly safe. To get away from the idea that it sounds like such a toxic dose, 20,000 of everything sounds too much. 40,000 IU of vitamin D is 1 milligram. I'm going with a higher amount. So if I had a child, I would go with at least maybe 6,000 IU, something like that. Don't let it scare you. It's not too much as long as you have some vitamin K2. And get sunlight as well. No one's done these studies, but I personally believe if you supplemented yourself up to 100 and then you went in the sun, you wouldn't get much higher than that because Mother Nature wouldn't make more vitamin D for you. So
Okay.
I wouldn't be too worried about that, but I like a combination of both. If you can get kids to go in the sun, and remember that sunscreen will filter almost all vitamin D. So
Yeah.
if you're going to put your child in the sun, don't panic. Put them in the sun for 5 minutes or 7 minutes at midday without any sunscreen. They're going to be fine. Okay. Don't leave them out in the sun for a long time because they're going to burn. You have to
Yeah.
understand that there are certain conditions that. So you want to be reasonable, but you can raise it fairly quickly. So you definitely want to protect your face if you're going to be out in the sun for a long time. That also includes a hat, even though there's lots of reflection. So you do have to be careful. I'm less concerned with putting sunscreen on my body than I am about covering my face or recommending having your face covered. Titanium dioxide, zinc oxide, or titanium oxide, zinc oxide. You just want a mineral sunscreen that's going to look kind of white and pasty, and you want to make sure it's non-nanoparticle. Anyone listening to this is probably already health aware. You don't want oxybenzone, avobenzone. If you wouldn't spray it in your mouth, don't put it on your body, is how I feel.
Yeah.
I'd rather bring a
Okay.
long sleeve shirt and stay out of the sun after being in the sun than spray anything on my body. I'm not into sunscreen at all, but I will put mineral sunscreen on those parts if I don't have an option. And the other thing is sunglasses. Don't wear sunglasses when you walk around. Sunlight in your eyes tells your brain what time of year, what time of day, and sends a signal for you to produce melanin in your cells. If you wear sunglasses and you're out in the sun, your body doesn't know that you're going to need to make melanin, which is Mother Nature's sunscreen. And newer information, I'm not sure if you follow Dr. Jack Kruse, he's really putting a lot of stuff out there about melanin is being a trap for deuterium. Melanin is a semiconductor. So when we get a tan, we're really taking in the sun's energy and it's allowing us to get rid of some of our toxins. So when you hear a dermatologist say no tan is healthy, it's nonsense. And I think
Right.
that Mother Nature doesn't make mistakes. There's 3 types of skin cancer: squamous cell carcinoma, basal cell carcinoma, and melanoma. Melanoma is the bad one. We get squamous cell and basal cell carcinoma on our ears, on our nose, on our head, on our lower lip. Very, very common. We get melanoma behind your elbow, behind your knee. People who get melanoma, they're extremely vitamin D deficient. They don't have enough sunlight, period. The one thing I can say is it doesn't matter. Studies support this. People who work outdoors have a lower incidence of melanoma. And those are real studies you can look up on PubMed. Common sense says that if melanoma were caused by too much sun, you'd see them on our noses, our ears, and on our head. And we just don't
Right.
see that. We just don't.
Okay.
I don't need a study to tell me this, that bruxism and snoring are caused by low vitamin D, because if you have a kid and they snore and grind your teeth, you give them vitamin D. They stop after 2-3 days. Then you take it away and they start to snore and grind their teeth again. How much more proof do you need?
Right.
Who do you want to pay for a study that will lose big pharma billions of dollars? No one's going to do it. Got to use your common sense. IBD, inflammatory bowel disease, Crohn's disease, or ulcerative colitis, SIBO, any disease. I have an ebook called Reversing Crohn's Disease Organically on Amazon. And it's a step-by-step process on what I did to reverse my Crohn's disease. I am not a medical doctor. I'm just a dentist. But this was my protocol of what I did. And I linked it to all the scientific studies that verified how I put together this program. It's really easy. And if you're on Big Pharma's medications, it doesn't matter. You should still look at this. Send it to a friend. Okay.
Right.
Contact me directly. I charge $5 for it on Amazon. But if you contact me with a story, I'll send it to you for free. Okay. I
Okay.
want to have a testimonial. All
Yeah.
right.
Okay.
Okay.
Right.
So once you get told you have an autoimmune disease, you're told it's genetic. And I was told this is what you got. You're Eastern European Jewish descent. You get Crohn's disease. Too bad. Now, over the years, I went to many different doctors to figure out what can I do because these medications I was taking were terrible. But I tried the new ones. Nothing really helped me. At that time, the diet for Crohn's disease was really non-existent because no one really knew what was causing this and no one cared. So I had, doctors say, eat only vegetables, don't eat any meat. And I had another doctor say, don't eat any vegetables, eat only meat. I didn't get that advice, eat only meat, because we were just getting into a time where we were told that meat wasn't good. In the 1980s, my mom came home and said, sorry, kids, we're changing our diet. She made meat 6 nights a week, and she was a great cook, and she shifted to pasta. Gee,
Yeah.
I wonder why I got fat. Great.
Uh,
That's what we went through in the 80s. We brought in sunscreen and margarine and toxic crap. My life was destroyed. Every moment, every joy, every fun thing I was supposed to do didn't exist because it was just all about the bathroom. And it wasn't just the pain and the embarrassment and the running to the bathroom. It was the fear of embarrassing myself in front of people as a grown man, the fear
right.
of being on a plane, not having a bathroom. And it's the neuroses of improper sleep with low vitamin D, anxiety, depression. And what it comes down to is being stuck in fight or flight and not getting to rest and digest. And that's where sleep apnea comes in. So I was sick for my entire life until I started to get worse with anxiety, depression, MRSA, methicillin-resistant Staph aureus, and severe bruxism, and I was unhappy. I was diagnosed with sleep apnea by accident. So what sleep apnea is it's one of the aspects of the disease that I'm calling the modern epidemic. That's my book. And it's the syndrome of being disconnected from your natural habitat. Sleep apnea is root cause is low vitamin D. Why? Because vitamin D regulates the gut microbiome, and the gut microbiome makes B vitamins. You'll see in my book a cartoon character called the bees. There are 8 B vitamins. B12 is just one of them. If you take B12, great. But there are 8 B vitamins, and they really work together. They collaborate. So if you don't have enough B vitamins, specifically B5, but many of the other ones, you can't run your mitochondria properly, and you can't make acetylcholine. Acetylcholine is a neurotransmitter, and it's the primary neurotransmitter of the rest and digest portion of the autonomic nervous system. And that's it. That's why everyone's stuck in, they're stressed. Everyone is stuck in fight or flight, and they can't gear down for sleep. If you're listening to this and you have insomnia, you can't shut your mind off, this is why. Your body doesn't have enough B vitamins, and you cannot make acetylcholine. You'll be lying in bed with your mind racing. The treatment portion comes when it comes to my books, and that is that you need to understand about your B vitamins because you're supposed to be making them in the gut microbiome, but glyphosate, wouldn't you know, kills your ability to make those B vitamins, and they're critical for the production of energy everywhere in your body in the mitochondria powerhouse of the cell.
Yeah.
And that's why I created the cartoon character Marty Mitochondria that you see behind me. That's him right there. It's got a little lightning bolt that represents the inner mitochondrial membrane. They were talking about being fat. They were talking about a fat neck, and they were saying this fat neck is crushing on you. This is your fault. You're terrible. How dare you get fat? But they
Yeah.
weren't seeing the 23-year-old petite female patients that I was seeing with terrible apnea. They weren't seeing the men who were working long hours at the office who are hitting 42, 45 fit guys working out at the gym with terrible apnea. That wasn't out there. And instead, the dentists of my community and all around North America, they want to do surgery. They want to do surgery on kids. They want to do all these drastic measures. They want to put CPAPs on kids. And what they don't know, and what is still not known, is that it's a simple vitamin D3, vitamin K2 deficiency that's at the root cause of this. So to all those who've had surgery in their jaws, some people needed it. Some people had tiny jaws. Why? Low vitamin D3 and vitamin K2 in their youth. But if you're an adult who wears a CPAP, has sleep apnea, you don't monitor your vitamin D level, you definitely want to check out some of my stuff, because I will get people who come to me who wear CPAPs and they say, I'm wearing my CPAP, but I still can't sleep. And those are the people that need the vitamin D supplementation so profoundly. Their lives change because they're already doing the work. They're already wearing a CPAP every night, which is hard. But until their vitamin D level comes up, they do not have success with sleep. At the age of 48, everything changed. and I've been still working at getting healthy. I have reduced my sleep apnea score, my AHI, apnea hypopnea index, from 22 down to about a 5 or a 4. And I don't wear a CPAP, and I don't wear an oral device anymore. Okay. And the reason is I've reversed my apnea because I figured out what the root cause is. I don't sleep perfectly because I have to be careful. You have to worry about the light in your eyes, blocking your blue light at night, all the things that have changed for us humans in our environment. But I try and, I never have, my phone's always on airplane mode, have a red old digital alarm clock. You don't want to look at your phone in the middle of the night. Whatever you can do to get the best night's sleep, do it. And that does include putting the things in your nose and taping your mouth. Do it. Anything that helps air get in is an absolute benefit. But keep in mind that I will see people who dose their B vitamins properly have a great reduction in their apnea. Years ago, or 90 years ago, if I would have had this information, I would have had a different life. I suffered profoundly for 34 years for no good reason, other than that nobody put this information out there. So the buck stops with me. When all this happened to me and I regained my life, I said to myself, I have one thing that I have to do. I lost my life to this disease. And my job is to put this out there so firmly into popular culture that it can never be removed, like it was from the Flexner report. And I think people are really starting to wake up to see just how badly they're being manipulated for profit by companies who don't even need the money. I'm just saying that. I think you know who those companies are.
Yeah.
This is a time where people really need to wake up, and they may never understand the science that I'm presenting, but your kids will. These cartoon characters behind me, these are enzymes and vitamins and minerals. My characters called the Heroes of Light. These are heroes to follow. These are the celebrity VIP vitamins, minerals, and biologic components of who we are. If your child spends time in my paradigm, they're going to have a good time. They're going to go to Roblox. They're going to go be in the metaverse. They're going to go and do all the things they're doing now. It's just that the stuff they're going to learn and memorize is going to be the electron transport chain. It's going to be how enzymes put things together and take them apart. So the natural conclusion for the life that I had is, for me, at the end of my 33-year career in dentistry, really to move into sharing this information. It's the most important thing that I will ever do in my life, and I take this very seriously. I think of the children who are dying from cancer and from other diseases. And yes, cancer is extremely related to low vitamin D, extremely. I'm not going to say that vitamin D deficiency causes cancer, but low vitamin D allows cancer to progress, plain and simple. It's irrefutable, and the studies are there. So to share this message, I have created, with one of my patients who's an artist and one of my friends who's an artist, a combination of vitamins and minerals and enzymes that sing and dance, and you will see on TikTok and Instagram. Some of them are already out there.